a burden on organizations, and then obviously, as we talked about, the government's increasing enforcement efforts as a result of new legislation, the HITECH Act in particular we're going to focus on today, as of 2009 and then being finalized in 2013 as to what the lay of the land is for data breaches and what organizations' responsibilities are with respect to notifying individuals and responding when there's a breach. All of these issues are creating more liability and exposure for the organization. Okay, now we're going to, next slide please. Now we are going to look at traditional, we're going to go very quickly through the D&O space here since this isn't entirely relevant to the dental organization risk environment, but it is important for you all to be aware that these types of exposures as a result of health reform are all going to have a trickle-down effect that's going to impact any organization that provides any sort of health care services, even in the allied health space. So, you know, we have traditional heightened exposures for provider selection, which are peer review, you know, doctors evaluating each other. You may have in some dental practices the peer review system where dentists evaluate each other's performance. That can create issues in terms of claims. Antitrust allegations brought from competitors and government regulators. Again, the more that organizations affiliate to provide more efficient delivery of care in a community, it creates the potential for competing competitors to say that this affiliation is unfair. It creates too much of an uncompetitive environment, and sometimes the government will intercede and agree with that. We don't see so much of that happening in the healthcare dental space, but it is a reality that's going to impact the whole sector. As the government has indicated, they're going to continue to prosecute these anti-competitive situations, notwithstanding the fact that health reform has encouraged the adoption of collaborative care between providers. Healthcare fraud and abuse enforcement has increased in terms of Medicare and Medicaid accidental overbilling, intentional overbilling, and then entity coverage for your organization. You know, any sort of wrongful act or default to a governance, you know, an oversight issue can result in heightened claims right now. And the reasons for this pressure increasing are, as we talked about, health reform, an increasing aging population that's living longer and demanding more expensive and a greater number of services. All the while, the government reimbursement under Medicare and Medicaid is decreasing and shrinking,